How much are you actually eating at this point, and what does it look like a typical day?
So, I mean, right now I am, at this point I'm trying to lean down a little bit. So I started, I don't know, about a year ago at 270. I'm now about 245. Um, and so I probably consume about 2 pounds of meat a day. And to that, I'll add a little bit of fat, is what I'm doing currently. That's down from what I would do kind of more to the maintenance sort of this position, which would be closer to 3 pounds, because I think protein is as most people do at this point is incredibly important. We've sort of under proteined the population for so long with this, RDA, 0.8 grams per kilogram as a US RDA recommendation, which I think is going to interestingly, is going to have a big change coming up here in the next probably 3 to 4 months. We're going to see a change on that. But we chronically recommended too little protein for most people, and it's led to a lot of problems, quite honestly. And so, yeah, I mean, I eat, I always have a lot of protein, but when I'm trying to gain weight, I might be eating 5 pounds of meat a day. If I'm trying to maintain my weight, it's going to be 3.5, somewhere in that neighborhood. And then when I'm trying to lose weight, probably closer to 2.5 pounds. And the interesting thing for me is it doesn't really matter. I don't really feel better or worse on any one of this. I don't really have much appetite change. I'm about the same level of hungriness on any of those. So it's kind of, I can just dial where I want to be. Do I want to be heavier, stronger? Do I want to be a little lighter, quicker? And right now I'm on that other end where I spent from about age 53 to about 58 trying to get stronger and bigger. And I successfully did that. Now I'm dialing it down as I get closer to 60 so I can, dunk a basketball and do a backflip and, sprint 100 meters in under 13 seconds and 400 meters in under 60 seconds and all the things that I want to try to do.
At this point, you've already cut a lot of that weight. What is the end goal? Are you getting close?
Well, the end goal is based on performance, right? So I'm going to, like I said, I mean, pure physics dictates that, if you're, when you're running a sprint, the lighter guy is going to usually go faster than the heavier guy, assuming, other things are equal. So, I mean, there's going to be a threshold point where, Noah Lyles won the Olympic gold medal. He weighs 150 pounds. He doesn't weigh 250. There's a very good reason for that. So, I mean, it's like, so it's all dependent upon outcome, performance metric. I'm not so concerned about aesthetics and things like that. I mean, obviously I don't want to be obese, but I mean, I just want to be able to perform well. And so this is going to be, so I suspect, based on where I am now and what the goals I want to hit, it's probably going to look like around 10 pounds more. I'd say something like that would be my guess. We'll see when we get there, and then, I'll probably change as goals change later. I just have these performance goals that I'm very much driven by athleticism. And it's kind of interesting because I get a lot of people that will say that, well, just because you're physically performing well athletically, that doesn't mean you're healthy. And I would strongly counter that. I said, absolutely it does. I mean, you by definition have to be relatively healthy, particularly at this age, to do those things. And I include musculoskeletal health in that because, I look at it as, you can talk about heart and lungs, which are obviously incredibly important, but guess what happens? If you got a car with the nicest engine in the world in it, but it's got flat tires, it ain't going anywhere. And that engine is going to seize up and rust anyway. So you got to maintain this chassis, this, the four limbs in our back in good health. And the diet does play a role in that. People tell me about, well, you could do this on any diet, but I can tell you that I've done all kinds of diets in my life and I don't feel as good from a musculoskeletal standpoint. And the fact that my knees don't hurt and my back doesn't hurt, my shoulders don't hurt at almost 60 years of age is, not that kind. You see a lot of people that struggle with that. And I don't struggle with that like I did in my 40s, where I was just kind of somewhat at a point where I was accepting this gradual decline because I saw everybody around. As an orthopedic surgeon, so I saw all day, every day in my office, people come with rotator cuff issues and knee arthritis and back pain and hip pain. And, it's easy to think that is just normal aging. And that's what I was instructed. That's how I was trained as a surgeon. But when you really look at it, it's like, wait a minute, if you just change your diet, maybe your knee's not going to hurt as much. And I see that every day. And so when your knee doesn't hurt as much, guess what? Now you can go play harder, right? You can play more. And when you can play more, your heart and lungs work better, right? So it all builds on itself. So
by what you just shared there, as an overall diet, carnivore is serving you for performance. But if you were, say, leading up to an event or doing a sprint or a heavy lift, have you played around with introducing carbs one off and then any boost in performance from that?
Yeah, I did that years ago when I was on a ketogenic diet. I mean, there was all these targeted and cyclic ketogenic diets and carb night backloading. I played with that over the years. And honestly, I didn't see much of a significant difference, quite honestly. And, the literature that's coming out now shows that that really doesn't have much of an impact unless your activity level is lasting well over an hour and it's very intense. And I just don't do those things. I have no interest in running marathons. I could give a flying if I ever ran more than a mile. I mean, I can get out there and run a mile fairly quickly. But the data that's out there is generally like I said, if you're a Tour de France cyclist or you're a Kona Ironman guy or wants to run ultra marathons, and yes, you're going to see a benefit from adding some carbohydrate. It's not very much, by the way. I mean, the latest data shows it's just enough to keep that blood glucose sufficiently high. It's not about refilling glycogen or anything like that. It's just about managing blood glucose. And for what I do, weightlifting, sprinting, jumping, I don't need I don't need carbs to modulate my performance at all. And in fact, what I would see is anytime I would include a significant amount of carbohydrates in there, I just didn't feel as good. I mean, I would develop, maybe it's a fault of mine or the fact that I'm old. I just felt that it just didn't serve me well from the inflammatory standpoint. And so it could be, you didn't try the right carbs. And yeah, I mean, that may be potentially an issue, but rice and fruit and things like that, oats, which most people would consider good sources of carbs. Those things certainly didn't help my gut. And, I remember when I was doing the carb backloading in particular, I mean, you'd have to eat a lot of carbohydrates, based on my size. I was looking at, this is what it's projected. They were asking me to eat like 800 grams of carbohydrates on a carb load day. And, at first I thought, oh, this is cool. I'm going to get to eat all these carbs and yum, yum, yum. And I mean, by the end of the day, I was just miserable. I was like, oh man, I can't eat all this stuff. This is awful. And again, I tried a lot of different variations where I would do targeted stuff where I just have a little bit around workouts. And it never resulted in any significant performance advantage. So I saw no benefit to that for me. Maybe it's because I was 50 when I was doing it instead of 22. And, again, that's maybe my 22-year-old self, which I did eat. I ate carbs when I was a young kid, for sure. And I performed well until I was unable to. So that's just the way it is.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
The last 9 years, I've probably consumed, without exaggeration, like 10,000 steaks. That was one of the things that struck me 10 years ago when I first went carnivore. It was like, I don't even know my digestive system's working because I don't feel anything. I have no perception of digestion.